Hi all, I'm Dr. Neema Bhat, Senior Consultant Hematologist, bone marrow transplant physician, and a pediatric oncologist. Have you heard about the culture of taking treatment in daycare centers? Have you heard of something called daycare center? So what is a daycare center and what exactly is the advantage a daycare center offers over taking treatment in a hospital? So the reason I'm talking about daycare centers is I head the unit of hematology and pediatric oncology here at Therrapie, Hematology and Oncology Cancer Care. I trained my undergrad in India. That means I did my MBBS in India. And then for my postgraduate education, I went to the US and did my residency and fellowship over there. During my training in the US, I noticed that a lot of patients, because the number of centers that offer specialized care, which are part of, big hospitals, are very few in the US. They are maybe one in every 200, 250 miles, especially in the Midwest and, the lesser populated areas of the United States. So where would these patients all go for their treatment? Because you cannot really go to a big center and stand waiting in long lines or have long waiting times, especially if you're coming from very far off. Most of these patients would take their treatment, even if the oncology related condition, they would take their chemotherapy or other treatment related to their blood disorders in these centers called daycare centers. So what are daycare centers? They are much smaller centers compared to a hospital, which basically has a clinic feel or look to it, where you have consultation rooms and you have separate smaller rooms, very similar to a hospital, but with a different outlook, as in you don't have the normal logistics that you have to take care of in a hospital setup, in a clinic or daycare setup. A clinic or daycare setup is open on most of the days of the week and open during working hours from morning until evening. And the number of patients that come to a clinic or daycare setting are usually much less sicker. They're not as sick as patients that go to bigger hospitals. The risk of infection is very, very less because the risk of exposure to a large number of sicker patients is lesser. The waiting time in clinic and daycare setups is much lesser because you probably have to go through a receptionist or you have to go through a nurse and a duty doctor before you see the main consultant or the doctor. You don't have to go through a series of people, like the admissions counter, the logistics manager, and multiple other layers that you basically have to cross in a multi-specialty hospital. You get more individual attention because the number of patients are lesser in a clinic or daycare setting. The doctor is able to give you a little bit more of their time because these are usually in the evening hours when we don't have long OPDs. And this is speaking as a consultant who also works in a multi-specialty hospital, that I'm personally able to give a little more time to my patients because it's in the evenings and patients have a little bit more of a relaxed feel compared to when they're in a big hospital talking about cancer. Apart from this, cost-wise, a daycare or clinic ends up being a lot more cost-effective because of various reasons, that's involved with the logistics and running of a big hospital. All those layers get cut off when it comes to a clinic or daycare. So expenses-wise, it's a little better. And as I said, you get a lot more individual attention. You get a little bit of a comprehensive, wholesome care in a clinic setting. All, of course, with much less stress and much more better ambience because you're not in a proper hospital where you see nurses, doctors, all of them, in their uniforms in a very formal setting. This is a much more relaxed and less stressful environment for you to come and take a high stress treatment, even if it is like something, like chemotherapy for your cancer. So I welcome you all to please come and check out the Therrapie, Hematology and Cancer Clinic from myself and all of our staff here. If you have any questions, please feel free to reach out to us on our website and we look forward to seeing you soon. Thank you.